India's healthcare market is undergoing a transformation with economic growth of more than 7%. Driving this demand, the industry is expected to triple in size to $280 billion by 2020. However, the Indian healthcare system currently lacks sufficient infrastructure to meet the healthcare demands of the country. This leads to supply-demand imbalance and making healthcare less affordable and accessible for all. India, at the same time, is also one of the fastest technology adopters globally. The country's healthcare system is being reshaped by three forces: increasing healthcare demand, technological ubiquity, and rising patient awareness. The healthcare sector could be revolutionized by new technology and digital entrants in health startups that will fill the void with their own offerings. Digital health startups and technology incumbents are already using their engineering skills and data analytics expertise to create new products and services that satisfy the demands of consumers, physicians, and payers. And need of the hour is finding the brightest of the ideas and supporting them to grow. Fortis Healthcare has come forward to offer a helping hand with its initiative, Superstarters Inc., a startup challenge that will act as a launchpad for new, previously untested and unimplemented healthcare ideas for the country. The initiative will provide a platform to young entrepreneurs where they have seamless access to clinicians, patients, data, and infrastructure and hospital ecosystem. This would help them build the products keeping in mind the real-time outcomes. So let's visit Superstarters Inc. and unveil some amazing healthcare wonders that await India in 2019.
Welcome to the first episode of a brand new show, Fortis presents Superstarters Inc., a show which talks about different startups initiated by youngsters for the healthcare segment. Mr. Bhavdeep Singh, the CEO of Fortis, is with us. Welcome to our show, sir.
Thank you very much.
What was the vision behind this initiative?
What's happening in India today with healthcare? From any perspective, whether you're a patient, whether you're a nurse, a doctor, or just an attendant or a family member of somebody who is suffering, the reality is that the industry is going through lots and lots of change right now. If you ask me today as a healthcare professional that to tell you what healthcare industry will look like in 5 years, if I told you anything other than I don't know, you'd have to be suspect of my answer. Because the reality is none of us actually know where healthcare is headed. Not because there isn't a direction, it's because so much is changing around us. Right? As a planet, as a country, we've seen more change in the last 10 years than we saw in the 50 years before that, whether it's by virtue of technology, economic, whatever it might be. So we look at the healthcare environment, the disease burden is changing so dramatically, so rapidly. The whole middle class that we keep talking about is growing. The desire and need for access of quality healthcare continues to evolve and change as well. So the reality is that the current model doesn't work, not in the way that it should going forward. So I think that if you look at the landscape today, actually we need a whole lot of change. Now what kind of change? Whether it's in terms of treatment, whether it's in terms of diagnosis, whether it's in terms of access, whether it's in terms of communication, education, prevention, whatever it might be, I think those are the things that will get determined as we go forward. So I think that a platform like this where we actually encourage innovation, where we invite people to come and share their ideas, the reality is we may come in with 10 ideas, 20 ideas, and it might not be any of those ideas. So I think that this is a bit of a moving target, as it should be. I don't think that Bill Gates knew when he started in the late 70s, early 80s, and in his Harvard dorm room started tinkering around with the computer thinking that this is what would come out. But I think over a series of events, we end up in a place where eventually the world is a better place as well. So I think that's what's going to happen in healthcare. And I think that forums like this are fantastic because they start the discussion, start the dialogue, and get the energy flowing.
Looking at the initiatives taken up by you, how do you feel it is going to make a difference in the healthcare segment and how Fortis is going to support them?
So I think 2-3 things. Number one is the whole notion of access. How many people have access to healthcare? Right, if you look at what the private healthcare sector is doing, what the government healthcare sector is doing, I think that we are able to serve some percent of the population. There's still a lot of people that need quality healthcare. So one is access, and there's going to be a role that price plays in it. There's also going to be a role that technology plays in it, right? Because the whole notion of diagnosis, self-diagnosis, remote diagnosis, things that are coming as well. So that's one. The second thing is that the understanding what good treatment looks like. You know, there's been a whole lot of discussion around artificial intelligence. Right? IBM came out with Watson, for example, which is all built around the artificial intelligence component. But that's a lot about taking data and being able to accumulate data and put together a series of data points and agree and try to understand what's going to happen after that. So I think it's going to be on multiple fronts. I think that A, improving access, B, using technology, leveraging it. I think C, making sure that you involve more people, get more people involved. And I think the whole notion of collaboration and partnership. Today, it can't be that just doctors and nurses and administrators figure out what's going on in healthcare. Now, we're having this forum here today at the Fortis Hospital in Gurgaon. On my way down here, I must have talked to half a dozen different people who are just involved in different ways, and they'll be playing a role in it as well. So I think the whole collaboration piece will be a powerful component as well.
So how do you see the future of healthcare segment after such initiative being taken up?
The traditional form, the traditional notion of a patient going to a doctor when they're sick, the doctor diagnosing them, either they get admitted or they go home, they take medication. I think that whole notion is going to start to evolve and change. 20 years ago, you couldn't check your own blood sugar. 10 years ago, you couldn't just walk into a random office building and get your blood pressure checked. These are all things we can do today. So the whole notion of a patient playing a greater role in their own healthcare and being involved in what that looks like. The whole notion of access and availability of information. The notion of actually improving the quality of life of people by virtue of education and prevention. We actually haven't gotten to the stage. 10 years ago, 15 years ago, 20 years ago, mental health was such a very, very small piece of healthcare. Today it's becoming a bigger and bigger piece. Not because the mental health situation has changed in India. It is whatever it was, it continues to be now. Just the fact that we're becoming far more intelligent and understanding, and we're able to do something about it.
It's time to talk to one of the partners who have contributed in Fortis Superstarters Inc. Let's take a look and see what they have to say.
Fortis reached out to us as a partner, and we are really thankful of Fortis to help to get us on the stage for the startup challenge. It's been heartening to see the kind of business plans what we have received, right from mobile health to fetal stress management to drone delivery of drugs and mobile diabetic screening, so on and so forth. So it has got an amazing lineup of starters which have come onto it, and each and every one would have a great impact in this space. Talking about our future with the Fortis on this initiative, we are really very excited on this space. Commitment they made today to all their startups over here in terms of go-to-market strategy, getting them under their wings, supporting with the market access and possible funding, if not yet committed, but there could be possible funding. So it's a great initiative. We have a lot of our members who may get benefit and value out of this partnership, and we would have our inherent interest to work with Fortis onto it to bring out value for our members as well. So it's a great initiative, and we would like to take it on a long-term basis.
We have the winner with us of Superstarters Inc., Shubham Mishra, a young IITian. Let's talk to him and see what made him a clear-cut winner in this show. Welcome to our show, Shubham. So what was your concept and idea that made you stand apart in the rest of the crowd?
Actually, we have developed nano lenses which can detect biological analytes in its proximity. So we have fabricated a flow cytometer. This is the cheapest flow cytometer which can be used to segregate and sort out cancerous cells, platelets, and basic biological analytes, red blood cells or white blood cells.
So from where did you got this idea, and what are the challenges that you faced while working on your idea?
Actually, this is a project written by my supervisor, Dr. Ankur Verma, and surface technology is the basic feature in developing these lenses, and we used our basic lab facility to develop this equipment.
That's a great idea, and congratulations from our end. So where do you see your idea in the healthcare segment, and how it's going to benefit us in the healthcare industry in India?
Actually, this is the cheapest flow cytometer which can be used to diagnose dengue and cancer, and in various other fields like immunopathology, cytopathology. So for dengue and cancer, you can detect cells within fraction of minutes with a less cost than 20 rupees.
So what is the entire costing that any patient would have to incur to understand what exactly it is and how they are going to get benefit out of it?
Actually, it's very easy to operate. You can, even a less skilled person can operate it very easily. So cost is just 15 rupees. Even after including capital cost and working cost, it will be less than 40 to 50 rupees. So it won't be a problem, and anyone can operate it.
So Shubham, who do you want to dedicate this victory to? And what was the motivation behind this initiative?
I want to dedicate all my achievements to my supervisor, Dr. Ankur Verma, and my parents, Manju Mishra and Sri Ram Shabila Mishra.
So what is the future plan of this concept? Where you want to take it to the next level? What is the present scenario of this?
This equipment is ready at lab scale, and in next a few months we are going to make it market ready, and technology enhancement will be continued forever. So I hope within 1 year this technology will be ready in the market, and this kind of platforms will help us in that.